Thank you, Tracy. Good morning, everyone. On behalf of the Construction Association of Michigan and our partners at VeriPro, I'd like to welcome you to our Maximizing Client Value program this morning in an effort to introduce to you, the agent and broker community, our new level-funded healthcare plan at CAM called CAMPRO. Tracy, if you can just hit the next slide, I'll do some brief introductions here. I would like to introduce, I think I've introduced myself. My name is Kevin Kohler. I'm the president of CAM. We have Tina Pelland. Tina is the president of VeriPro, which is the TPA that'll be administering the program. We have Tom Middlebrun, who is the benefit consultant from T3 Advisory. Tom is an old friend and has been involved in the construction industry for many years, so some of you may already know Tom. And then we have Lisa Harrelweimer, and Lisa is the manager of business development and financial analyst at VeriPro, and as I like to call Lisa, the program expert on the CAMPRO program. So to give you a little background on how this program and why it was established, CAMPRO is a level-funded health insurance product designed specifically for the construction industry. One of the things that we were seeing here at CAM is many members coming to us saying, Kevin, we can't handle these double-digit increases every time we go to re-up our insurance. We have escalating drug prices across the board, and we're really striving and trying to keep our employees gainfully employed. And with that, we need a solid health insurance program. And you can see in the slide here, we included an article that was recently in Cranes stating that the Blues and Priority Health and some of the other major insurers throughout the state have had double-digit increases year over year. And as all of you know, I employ 21 employees, and it's a major line item on my balance sheet or on my income statement, in my budget every single year. And we just felt like enough. We need to try to look at an alternative to the group insurance market. And as some of you may know, CAM in the past, Tracy, you can probably click to the next slide. CAM in the past worked with the CAM benefit program and CAM administrative services, and we did have our own level funded product, which was sold about 4 or 5 years ago. We reached out to the experts at VeriPro, and we built another level funded product designed specifically for your construction clients. And we feel that we've got a great product that gives them a viable alternative. And you as agents and brokers, we'd like to tell you a little bit more about the program and hopefully have you quote it to your clients. And this is available to anyone in construction, anyone that supplies the construction industry, anyone even remotely involved in construction. To give you a little background on CAM, CAM is the oldest and largest regional construction association in North America. We're headquartered in Bloomfield Hills. We own our own building at Square Lake and Woodward. We have 2,000 commercial and industrial construction trade members, as well as Tracy in our prospect system, probably 20,000 prospects for membership. So we've got a list of a lot of contractors out there that we're willing to share with any agents that are aggressive and want to sell our program. We're super excited to partner with VeriPro, who is a TPA that helped us build CAMPRO, hence VeriPro, CAMPRO. Pretty cool, pretty clever. We're excited about it, and I think that's enough of an introduction. Tina, why don't I turn it over to you and we can get into the nitty-gritty of the program and talk a little bit more about the bones on the meat.
All right. Well, thanks, Kevin.
On the bones.
Well, good morning. Just a little bit about VeriPro. VeriPro is a full-service TPA. We provide innovative solutions to deliver high-quality, high-value healthcare products and services in a cost-effective and affordable way. Now, VeriPro is not owned by a carrier, which allows us the flexibility to work with any vendor or carrier to provide clients with a customized, client-focused benefit plan committed to cost control and flexibility. We believe not a one-size-fits-all, and have provided, we have been provided the opportunity and to collaborate with CAM in building CAMPRO, which has been designed with employer convenience and adaptability at its core. We've partnered with Health Alliance Plan, utilizing their network and pricing through leasing arrangements. Basically, CAMPRO as a whole We offer 6 comprehensive self-funded medical plans and 3 self-funded prescription drug plans. These plans can be offered as level-funded plans, combining the advantages of traditionally full insured with the cost savings of self-insurance. Now, as noted earlier, CAMPRO leverages the Health Alliance Plan, ensuring access to the provider networks for CAM members. And for RX, CAMPRO has partnered with ProAct, which is a boutique pharmacy vendor specializing in cost mitigation strategies. With that, I'm going to have Lisa walk you through the program partners.
Hi, everybody. All right, so Tina mentioned HAP already as far as the in-network provider in Michigan, ProAct as the PBM. For out of network and out of state, we use Valens. So my bottom left corner. I don't know if it's your bottom left corner. On the stop loss side, we have 2 partners. So Stealth is an MGU, so they are going to be here. So we talk about level funded. We can also look at traditional self-funded. So Stealth would be here to quote traditional self-funded. So your larger business, we can use Stealth, or as a broker, you can bring your own stop loss carrier. I think that's an important part to know. On the level funded program, we will use ISI. They will do all of the level funded underwriting on the stop loss. We also bring Health Joy. We'll spend a little bit of time talking a little bit more about Health Joy services later, but they're a concierge service for healthcare navigation and member services. For dental and vision, we are bringing some fully insured products. So Delta Dental is bringing a couple of dental products. In NVA, we have some fully insured and voluntary options. So that is the CAMPRO partner program.
And some of the benefits of CAMPRO are quality healthcare solutions at affordable rates. Level funded plans offer access to high quality healthcare networks and services while providing cost control through predictable monthly payments and potential savings at the year end. Now, if there's savings, those savings are returned at 100% to the employer group. Number 2, another benefit is elevated medical and RX administration. We have a streamlined enrollment process. And I think one of the bigger advantages working with VeriPro is that you have claims data transparency. Brokers and employers gain access to detailed claims data and reporting, empowering informed decision making and promoting accountability across the healthcare journey. And lastly, there's an enhanced member experience. As Lisa stated, we are going to work with Health Joy if you select it. It's an optional concierge service that they provide expert assistance with tasks like comparing providers and understanding medical bills. With using VeriPro, you have a streamlined approach with customer service and claim processing, which is critical components for a positive employee experience. So with that, I think we're going to go to the next slide about level funding.
Okay, well, here we go. Well, as Lisa and Tina touched on, level funding offers a nice combination of fully insured and self-funded plans, which is ideal for groups of 15 to 150 looking for the advantages of self-funding without fluctuating expenses. In other words, predictable budgeting and consistent monthly premiums. The insurance company holds the risk, potential return of premium or surplus if the claims are lower than expected, participation in prescription drug rebates. The group gets to see their own claims experience. Of course, as Tina mentioned, the data transparency is very important for anyone who owns a business or for the agents or brokers doing the analytical work to see what the best fit is for that employer. And of course, for the employers, I think level funding offers more control of their own destiny.
Mm-hmm. All right. Go ahead, Tom. Sorry.
No, I'm done.
Okay. Well, we're going to walk you through now the 6 medical plans and the 3 RX health coverage options. So Lisa's going to walk through some of those details.
All right, so I have Tracy pulling up the medical plan options. So as you can see, we have 6 plan options that Tina already alluded to. So 4 of those plan options are traditional PPO or EPO plans. So PPO in and out of network, EPO meaning no out of network coverage. So ranging from a 500, 1,000 to the 3,500, 7,000 deductible level. We also bring 2 qualified high deductible plans, as you can see on the screen. With those, you can pair an HSA or an HRA through VeraPro. In addition to what you're seeing here, Cobra is a part of the package and will be included on any applicable group for Cobra services through VeraPro. So those are our medical. Again, 6 standard plan options. We'll get a little bit into some of the details later, but there are customizable options for over 100 enrolled. So I think Tom will touch on that again later. So those are our medical standard plans that are out here. And then for prescription drugs, we created 3 standard plans on a 4T platform, as you can see. So generic, preferred brand, non-preferred brand, and specialty. Again, some customization is available as long as we have the right enrollment. So those are medical standard, RX standard plans. We'll flip to the dental screen. All right, so Delta Dental is offering fully insured block rate pricing for the CAMPRO members. So we have 2 plans, both fully insured through Delta Dental. One is a high plan, one is a low plan, pretty standard benefits from what you brokers see out in the market. So both of those are available. And then on the vision side, we have 3 vision plans being offered through NVA. These can be offered as fully insured or voluntary, all 3 plans. So that's a big thing to know on both of those. Now, outside of what you're seeing here, those are the standard plans that are being brought from the fully insured carriers. VeraPro also offers self-funded dental and vision. Typically, we recommend a minimum number of lives, about 25 there, but we can do self-funded vision, again, administered through VeraPro. Now I'm going to pass it back to Tina to talk a little bit more about the VeraPro services.
Yes, so we also administer HRAs, FSAs, and HSAs. We excel at administering and processing HRA plans. We have brokers that bring pretty complex HRA plan designs in an effort to just help employees, like employers come to them with solutions or to find solutions to help mitigate some of those high deductible health plan deductibles and whatnot from them. So with that, we specialize in creating a tiered cost sharing arrangement, and it allows employers to cover specific percentages of expenses before employee contributions begin, helping to ease the burden of high deductible health plans. We found that these thoughtfully structured plans have a positive impact on employee retention. So then that walks us over to the next slide, which is the concierge level employer and member experience. Basically, customer service and claim processing are critical components of the overall employee experience. And CAMPRO is committed to delivering that exceptional support. With VeraPro handling claims administration, as noted earlier, members have a seamless journey. There's efficient system. It's designed to ensure timely and accurate resolution. In addition, each group will be assigned a dedicated CAMPRO account manager at VeraPro. They'll have a dedicated customer service phone line. At ProAct, they'll have an in-house representative and full use of ProAct's mobile app. It's for convenient access to pharmacy benefits. And lastly, HealthJoy. Again, it's a concierge service. If selected, it also kind of assists in that healthcare journey. So next slide, please.
Why quote CAMPRO? Well, as we have discussed today, CAMPRO offers several medical and RX plans with optional dental, vision, and the Health Joy concierge service. Claims data for small to mid-sized groups, simple quoting process, agent flexibility on establishing the commission level. And there's a $2 per script commission automatically built into the administration fee. So I think there's a lot of reasons that these small to medium-sized groups or employers will find these level funding options attractive, hopefully for their group and for quite some time.
All right, so I'm going to go through some of the qualifications. We put the qualifications down for enrollment here, and I will touch on those. I do want to touch a little bit on the stop loss side. For level funding, there are a couple of key components that I do want to note. So stop loss contract, the way that we've developed the level funded plan is it will be on a 12-18 contract, so that we're providing that additional 6 months of runouts automatically in that first year. Incurred data paid in 18 months. And again, I will hit on the claims funding portion of that Tina noted and Tom noted, right? If there's always potential savings, if there are savings, that is 100% refunded to the employer group. VeraPro does not keep any of that money. I think that's important to note. The other thing to note on the aggregate or on the stop loss, right, is the aggregate quarter is set at 115%. Outside of that, the big things to note are qualifications on enrollment, right? So right now, our minimum group size for medical and prescription drug is 15 enrolled lives. On the Delta Dental, it's 25% of eligible lives. You have to have 2 minimum lives for a group on Delta Dental. NVA, it's 10 enrolled lives. And then again, I will note, as Kevin stated earlier, membership in CAM is mandatory for purchasing, but not for quoting. So those are the specific qualifications I kind of wanted to quickly go over. And then I'm going to have Tracy navigate to the CAM site, which we have linked in the presentation to show you where the data requirements are. So right on, buildwithcam.com, sorry. She'll navigate to the services. You'll see a healthcare plan. You'll see CAMPRO. I'm just going to talk about CAMPRO, give you some information. So down here at the bottom of this page, you're going to see three different links. So fully insured small group. So small group under 50 lives that's currently fully insured large group, you're 50 plus that's insured, and then your self-funded large group market. If we click on each one, we'll start with the small group. Each one of these tabs outlines the data requirements that are needed to quote. So any of these 3 tabs that you click on, it's going to tell you exactly what we need, pretty much verbatim. So you can see right here, all that really the biggest thing on your small group market is your membership data that drives your quote, which will be done right through ISI, through Gradient AI. And then some renewal information, plan design information. Now, it's important to note that on this specific one down at the bottom, there is a link to a request for quote form. Each one of them has a link. This one being level funded, it's a fillable PDF form. It includes the additional data we need. So your group name, your effective date that you're looking for, current information, the plan designs that you would like to see quoted. All of that's right here on the form, and we request that you fill out this form as well as send in the information that's listed as required data. So again, very easy, right on the CAM site for anybody to go out, grab, pull, look at, see what we need, send in a quote. On the bottom here, you'll see there's also a link on the RFP form. You'll see the CAM at verapro.com website. There's an email address we want you to send your quote request to, and then our sales phone number that will ring right through here to us, and we can answer any questions that you have. And with that, we will open this up to questions, if anybody has any questions.
Yeah, can you hear me okay?
Yes.
Yep.
Yeah, hey, Lisa, can you maybe just spend a couple minutes digging into the reporting And,
Oh,
you know,
sure.
some of that, because I think that's going to be unique
Yes.
with this program, right? Especially for small employers.
Yes. So as Tina, Tom, everybody has mentioned, right? Claims data reporting is huge. So we will be providing claims data reporting all the way down to that 15 enrolled life group members. So we have a aggregate report that we'll provide that provides your plan information, details, demographic information. It breaks out your claims. It gives some buckets on the medical side, prescription drug side. We will give you high cost claimant information for any high cost claimant that reaches $20,000 in claims. In addition to that, static monthly report included with that will be some details. So you're going to see the buckets that your claims are falling into, right? So you're going to see your lab dollars spent. You're going to see your DME supplies dollars spent. So we're going to provide that information. We're going to give you that detail. So you're going to know exactly where your claims are spent. In addition, there is ProAct does have some reporting, some key performance indicator reporting. So we're going to be providing all of that. So you're going to see it on the drug side and you're going to see it on the medical side. Any if you have any other questions as far as details, let me know. But that's the general gist of the reporting that will be provided, and it is provided every single month. Any other questions? Okay, no, doesn't look like it. So if you do have questions, that cam@verapro.com email address, you can use that email address to ask questions. That's going to come in and I'm going to pick up those questions and I will respond directly to any questions you may have. And then I will pass it back to Kevin.
Thank you, Lisa. I guess on a final note, I encourage all of you to take a look at this because it could be an attractive alternative to what you're offering some of your clients. And it may even be an alternative that can bring you new clients for you. So I thank you for your time today. We thank you for listening in. And again, Tina and Lisa and Tom are available with any questions that you may have. And if you have any questions for myself or for Tracy, get hold of us here at CAM. Thank you very much for participating today.
Thanks,
Thank you.
everybody.
Thank you.